Hello, I'm Dr. Keene. I've been in dentistry for over 40 years and have worked diligently along with the help of my staff to guide our patients towards oral health. This brief video is designed to show you the tools and the methods necessary for you to control and manage the health of your teeth and gums. I would like to suggest that you use these skills and materials to control the health of your mouth and then share that talent with your family. We will start with a selection of the toothbrush. It is a mistake to think that the more bristles, the better the brush. In fact, a small head is best to use. First off, the bristle diameters are extremely important. Stiff bristles will tend to damage gum tissue. Note that with this brush, the bristles are very flexible, thin, ends are polished, and the bristles will not puncture the gum tissue when the brush is used properly. In comparison, a toothbrush that has been chewed and with splayed bristles is not a good choice and should be discarded. Using a dry brush and starting systematically from one place to another in the mouth is important. Here you see that we've started in the lower right, in the back, and moved systematically approximately half a tooth at a time. Engage the bristles into the necks of the tooth, jiggle and sweep. Remove the dental plaque and food particles that have gathered around the teeth. Using a dry brush will give you the opportunity to experience what a clean mouth feels like without the mouthwash effect of the toothpaste. The bacterial plaques love to accumulate in the cuff of the turtleneck sweater that the gum tissue forms around your teeth. You will note with this technique, the bristles actually work their way into the cuff of the turtleneck sweater or gum tissue. The jiggling action helps break up the bacterial mats quite effectively. Continue this throughout the arch until you have completed cleaning the cheek side of both the upper and lower teeth. This method of cleaning focuses more on cleaning the teeth than the traditional scrubbing or brushing that we probably did as a child. Moving to the lower row of teeth, we will engage the brush bristles in the same manner. Start at the back, move forward, advance half a tooth at a time towards the front. When you reach the lower anterior teeth, rather than trying to use the brush sideways, insert the heel of the brush into the gum tissue, jiggle and sweep upwards, the handle of the brush extending straight out of your mouth. Continue now around to the tongue side of the lower right in a similar fashion. Moving to the upper row of teeth, the tongue side is a little more difficult, but work the bristles into the necks of the teeth, actually feel them there, jiggle, and then sweep. The upper anteriors can be cleaned in a similar fashion as the lower anterior teeth. The value of having a dry brush actually gives you a feeling of the actual cleanliness of your mouth. Let's not forget to clean the biting surfaces of the upper and lower teeth. Bacteria grow on the tongue, so it's necessary to clean the tongue by brushing it daily. You are most likely aware that the toothbrush has not been able to reach between our teeth. This is why using floss and other interdental aids helps remove the bacterial mats that collect there. Approximately 18 to 20 inches is sufficient for an adult mouth. Securing the floss is important when trying to use it. The floss is being wrapped around the joint of the middle two fingers of each hand. This reduces the floss cutting the circulation in the fingers. Demonstrated here is the amount of floss you can have between the hands to effectively manipulate in the mouth. When the floss is secured properly, you'll find it quite easy to manipulate the floss using the thumb and index finger. You will notice here that the floss is not tented across the contact areas and snapped into the gum tissue. This is very uncomfortable. You will note that the floss is brought up to the contact area and then brought against the adjacent tooth, swiped down over that surface, breaking up the bacterial mat. Instead of tenting the floss, swipe the floss at a diagonal as shown here and go down through the contact area, cleaning both surfaces of the teeth on either side. Unravel and wind the floss from one hand to the other so that a fresh area of floss is being used with each contact to avoid fraying and collecting pieces of floss between your teeth. We are often asked whether we should use a wax floss, a dental tape, or unwaxed floss. In fact, it matters not, whichever works best for you. The main thing is a floss that will scrape the bacterial mats that have collected in the hard-to-reach areas between the teeth. We suggest you only floss those teeth you wish to keep the rest of your life. A real handy floss aid are the one-handed floss holders, which makes it much easier to reach the hard-to-get-to places. There are many types of floss aids on the market. Select one that you find easy to use. Some of them even have a dental pick or interproximal cleaner on the other end of the handle. Interdental cleaning is also possible using toothpicks, fuzz-covered plastic toothpicks, and other devices. The one you see here is but one of many that are on the market. Select the interdental cleaner that best fits the spaces between your teeth. Never force objects between your teeth, as you can do damage. Basically, find that aid which allows you to clean the tooth surface as thoroughly as possible. Now that you've seen how you can clean your mouth effectively, let's go and see how you can help your child to establish good dental health habits. Be sure to locate that child in a comfortable position on the floor or even in a place where the head can be in your lap, such as on a bed or a comfortable couch. This way you are able to look directly into the mouth and see what you're doing. This is something you should do for a child once a day up until the time that child learns cursive writing. The child needs your help and supervision because they don't have the skills or manual dexterity necessary. You and the child should use toothpaste once a day. And this is a chance for the child to brush their own teeth. Selecting the correct quantity of toothpaste is very essential. Clearly, advertisements want you to use a lot of toothpaste, but a toothpaste with fluoride should be used once a day. A small dab in the center of the brush, about the size of a pea, is sufficient for cleaning. Folks selling toothpaste would have you believe you needed to cover all the bristles of a brush with paste. The reason we're cleaning our mouths thoroughly once a day is because dental plaque forms every 24 hours. It's the dental plaque that carries the bacteria that cause disease. Choosing health with gums that are pink and do not bleed when they are brushed is a choice that you have. Neglect of thorough cleaning can lead to the state where you have periodontal disease and vast numbers of cavities. I do not believe this is a choice you would make for yourself or for your child. If at first when you are cleaning your mouth you get some bleeding, do not be afraid. That just simply means the skin on your gums has been damaged by the plaque. Continuing thorough cleaning for 7 days, you will note that the bleeding will stop. Without the irritation of plaque, the skin will go back on your gums. Oral health is a good investment. It's something you can give yourself and your family with the simple techniques that you've seen. Applying these simple techniques will allow you to keep the keys to your dental health bus and have a life of health, comfort, function, and happiness. A clean mouth really tastes good.